We spend a lot of time discussing the thought process that surrounds perinatal mental health and postpartum depression and depression in general, really. I guess what we really haven't done is we said, hey, listen, like if you have these specific symptoms, or if you say yes to this question, this is when you need to watch out for it and go see a mental health professional. Tell us.
So thankfully these days, pediatricians are offering screenings like the PHQ-9 or the Edinburgh Postnatal Depression Scale. OBs are too, but typically if there's, an uncomplicated birth, they're seeing their OB for 6 to 8 weeks and then they're released to their primary care. Pediatricians are the ones who are seeing the moms more frequently. So that's a really important shift that's happening in pediatrics to, just because it's not the patient directly doesn't mean it's not impacting the patient. So yes, screening tools can be helpful as a screen. It's not giving you the total rundown of what all they're experiencing. It's just saying like, hey, look out for this. So if somebody is going to their doctor's office and getting the screen, ideally the doctor's also telling them what the score was and giving them resources to therapy or online support groups. One thing I want to mention is it's more than just depression and anxiety. As I mentioned, there's perinatal OCD. There's a bipolar disorder, sometimes onset postpartum. 50% of bipolar disorders in women show up in postpartum. And there's postpartum psychosis, which if there's an active psychosis, that's a medical emergency. So when we're talking about diagnosis and what that looks like, that covers quite a broad range of conditions. As I mentioned before, we're looking at intensity of symptoms and duration of symptoms. So if anything is, if you're experiencing like depression could show up as sadness, tearfulness, that anhedonia, not wanting to do anything, changes in eating and sleeping, which is hard because it's already shifted in postpartum. And especially if there are more severe symptoms like suicidal thoughts or even what I would describe as escape thoughts, like I don't want to be here. I don't want to die, but I don't want to be here. Those are more severe symptoms and, ideally should get referral to a therapist or a psychiatrist as soon as possible. Things like anxiety will be like the vigilance I mentioned before that I experienced, agitation, constant worry that's hard to set aside. It can show up in lots of physical ways, like changes in breathing patterns and heart rates, like really kind of shallow breathing is what a lot of people experience with anxiety. So this is a worry it could be generalized to like everything that's going on, or it could be hyper focused on just baby or something in the environment. If it's OCD, then you're looking at a pattern of obsessions and compulsions. So if I were to take my example, I was obsessively worried about my daughter's breathing. And my compulsion was that I had to check. I had to make sure she was breathing. I had to touch her belly and make sure it was rising and falling. I couldn't be okay until I did that. So it's not like, oh, I'm worried about it, but I see it and I'm good. That's more of what an OCD presentation is like. Bipolar disorder can go between depression and mania or hypomania. And depression, I already talked about a little bit with the down, sad, depressed feelings. But mania can look like really high energy, talking very quickly. There's one woman in particular who had what's called hypergraphia. She was constantly writing. She couldn't stop. And so changes in behavior, changes in like what you would consider personality might be more associated with a bipolar disorder or postpartum psychosis. Psychosis often shows up in the first couple of weeks, but it can show up anytime in the first year. Psychosis is when somebody's experiencing hallucinations, delusions. What's really difficult about psychosis is that symptoms can wax and wane. So at some point, somebody can seem very lucid and together and there and present, and then at another point be like withdrawn and distant and kind of responding to internal stimuli, if you will. They may be saying odd things or having odd behavior that is outside of their norm, but it is an emergency because the vast majority of people who have a postpartum psychosis, they might know something's not right, but they don't actually know what's happening. So they're they've sort of separated from themselves, and that can be dangerous for them. And unfortunately, the cases that you hear about in the news of postpartum psychosis that involves infanticide, those out of the 1 to 2 in 1,000 people that will experience postpartum psychosis, 4 to 5% will go on to suicide or infanticide. Sort of a relatively small number within the postpartum psychosis um, numbers. However, it's a risk. It's a risk. So as soon as you experience something like that, get somebody to a doctor right away.
I think it's really interesting. I think, like, after just talking to you, and hopefully, like, this is for a lot of people that will watch this, it's like it's like I go back and I'm like, "Oh, I definitely think that I had, like, postpartum anxiety for sure." Like, there were times like, our oldest, Amelia, was born September, and then that horrible, like, Sandy Hook thing happened a couple of months later,
Yep.
and I was just obsessive about watching it just really took over, like, my whole emotional health, which I'm sure it did for a lot of us. It was terrifying and very sad, but, like, just right after having a
Yeah.
baby, it was one of those, like, I couldn't get away from it.
Absolutely.
So
You of course it did. It's terrifying. And what you're saying is true for yeah, it's true for a lot of people. Like when there's natural disasters, when there's, horrible stuff happening in the news, it does increase our anxiety. And it's like a really good reminder to check in with people who've just had babies. Like the pandemic, oh, like rates of anxiety were so high because of course they were.